Hello everyone and welcome back to my channel. Myself Dr. Surpisani. Hope you are doing great. Today I come forward to talk about the another important topic of oral pathology, that is regarding the concrescence. Now concrescence means growing together. So basically concrescence is defined as a type of a fusion that takes place after the root completion is there. That means after the root completion it takes place, right? Or when the root completion has been completed or done, after that the fusion takes place, that is known as the concrescence. In concrescence they are united together by the cementum only without the confluence of the underlying dentine. That means the dentine is not combined yet, they are united through the cementum only. Now, what is the reason behind that? The first reason is the result of the traumatic injury. Second could be the crowding of the teeth that can result in the resorption of the internal bone, and that can lead to the two separate appropriate roots. Second could be the inflammatory damage to the roots of the teeth, which are get repaired later on by the cementum once the inciting processes get resolved. Most commonly, teeth which are involved in the concrescence condition is the maxillary and mandibular second and third molars. Clinical complications which is associated with the conditions of concrescence, that is, we have to do the clinically careful extraction of the concrescence tooth. Whenever it is present in the mouth of a patient, we need to do the extraction carefully, right? Followed by the next important topic is the accessory cusp. Now we have two types of the cusp. One is the cusp of cerebelli, which is an accessory cusp present on the palatal surface of the mesiolingual cusp of the maxillary first molar, which is the prominent one, followed by the second molar and the third molar. On the other hand, the second accessory cusp is the protostylid, which is an analogous accessory cusp present on the mesiobuccal cusp of the permanent molars or the deciduous molars. But there is one main difference. It is present on the mesiobuccal cusp, and cusp of cerebelli is present on the mesiolingual cusp. Protostylid is the NEET MDS question, because in normal routine theory you didn't read or talk about the protostylid, the another type of the accessory cusp. But if you are preparing for the NEET MDS preparation, definitely you require to study about this protostylid, which is the another type of the accessory cusp. So that's all about the today's video regarding the oral pathology topic. Definitely I come forward to talk about the next important topic of oral pathology. Till then, stay tuned, stay safe, and don't forget to follow me on my Instagram ID, and you can ask for the past papers of NEET MDS, that to 5-year set, 10-year set, 12-year set, 14-year set, or you can ask for the 5-year set of INI CET, that too with solution. It's a paid PDF set, so you can have it on your WhatsApp. For that, either you can drop me the mail which is shown on your screen, or you can follow me on my Instagram ID which is shown on your screen. Thank you for watching.